Welcome to the most comprehensive guide to lower back pain recovery you'll find anywhere. If you're here, you're likely dealing with persistent back pain that's affecting your daily life, your relationships, and your hope for the future. I want to start by acknowledging your struggle and sharing some truth that might surprise you. Recovery is not only possible, it's probable when you have the right information, support, and treatment approach. The reality of lower back pain in 2025. Lower back pain has reached epidemic proportions globally. We're looking at 619 million people worldwide currently suffering from this condition, with projections indicating this number will explode to 843 million by 2050. In the United States alone, nearly 30% of adults, that's 75.8 million people, experience chronic pain. This isn't just a medical problem, it's a human crisis affecting every aspect of life. The economic impact is staggering. The United States spends between $560 to $635 billion annually on back pain, exceeding the costs of cancer and diabetes combined. But behind these numbers are real people like you, facing daily challenges that extend far beyond physical discomfort. The psychological toll is equally devastating. Research shows that 40% of people with chronic back pain develop depression. Anxiety affects 36% of sufferers. The suicide rate among chronic pain patients is 46% higher than the general population. These statistics aren't meant to frighten you, but to validate your experience and emphasize that you're not alone in this struggle. Understanding different types of back pain. Not all back pain is the same, and understanding your specific type is crucial for effective treatment. Acute back pain lasts less than 6 weeks and typically resolves with appropriate care. Subacute pain persists for 6 to 12 weeks. Chronic pain, lasting more than 12 weeks, affects your daily functioning and requires a more comprehensive approach. Mechanical back pain, the most common type, results from problems with the spine's structure or how it moves. This includes muscle strains, ligament sprains, and disc problems. Nerve-related pain, such as sciatica, occurs when irritated nerves send shooting pain down your legs. Inflammatory conditions like ankylosing spondylitis cause morning stiffness and pain that improves with movement. Some back pain has no clear structural cause, called nonspecific lower back pain. This doesn't mean your pain isn't real. It simply means we can't pinpoint a specific anatomical problem. Importantly, the severity of your pain doesn't always correlate with structural damage seen on imaging. Critical warning signs. When back pain becomes a medical emergency. While most back pain isn't life-threatening, certain symptoms require immediate emergency attention. These red flag symptoms could indicate serious conditions that can cause permanent damage if not treated promptly. Cauda equina syndrome is the most serious emergency. This occurs when the bundle of nerves at the base of your spinal cord becomes compressed. Warning signs include sudden loss of bladder or bowel control, numbness in your groin, inner thighs or genital area, severe weakness in both legs, or inability to walk. This condition requires surgery within 24 to 48 hours to prevent permanent paralysis and lifelong incontinence. Other emergency situations include sudden severe weakness in your arms or legs, signs of spinal infection such as fever with back pain, severe pain after trauma, or symptoms suggesting a ruptured aortic aneurysm, like sudden severe chest or back pain described as tearing or ripping. Age-related red flags include new back pain in anyone under 18 or over 50 without clear cause. A history of cancer combined with new back pain requires urgent evaluation. Unexplained weight loss, severe night pain that doesn't improve with rest, or pain that worsens when lying down also warrant immediate medical attention. Revolutionary breakthrough treatments in 2024-2025. The landscape of back pain treatment has been revolutionized in the past year with groundbreaking new options that offer real hope for recovery. The most significant breakthrough is suzetrigine, approved by the FDA in January 2025 under the brand name Journavax. This represents the first new class of non-opioid pain medicine approved in over 20 years. Suzetrigine works by targeting specific sodium channels on pain-sensing nerve cells, effectively blocking pain signals from reaching your brain. Clinical trials showed statistically significant superior pain reduction compared to placebo, with no addiction potential. At $15.50 per pill, it's more expensive than traditional options, but patient support programs are available, and the safety profile is exceptional. The Intracept procedure represents another revolutionary advancement. This is the only FDA-approved treatment specifically designed for vertebrogenic back pain, which affects the vertebrae themselves. Using radiofrequency ablation, this minimally invasive outpatient procedure targets the basivertebral nerve within the vertebrae. Clinical studies show remarkable results. 64% of patients achieve over 50% pain relief, and 30% experience complete pain relief. The benefits last for years, with studies showing continued improvement 6 years after treatment. Spinal cord stimulation has evolved dramatically with closed-loop technology. The Medtronic Inceptiv system, approved in April 2024, represents the first device that senses biological signals and automatically adjusts stimulation in real time. This eliminates the need for constant manual programming and provides more consistent pain relief. Abbott has also expanded their spinal cord stimulation indications to include patients who haven't had or aren't eligible for back surgery. Robotic-assisted spine surgery has achieved unprecedented precision. Modern systems like the Maser X Stealth Edition and Excelsius GPS provide real-time navigation with 98.3% accuracy in hardware placement. This technology reduces radiation exposure by 10 to 12 times and significantly improves surgical outcomes with shorter recovery times. Evidence-based treatment success rates and recovery timelines. Let me share encouraging data about treatment effectiveness that should give you hope. For acute lower back pain, 80 to 90% of people experience significant improvement within 6 weeks with appropriate treatment. Physical therapy shows up to 60% improvement in symptoms, with most patients seeing benefits within 4 to 6 weeks of starting treatment. Conservative treatments recommended by the American College of Physicians show success rates of 39 to 76% for acute cases recovering within 6 weeks. Exercise therapy, supported by meta-analyses of 249 trials, demonstrates moderate evidence for both pain relief and functional improvement. Surgical interventions, when appropriately indicated, show excellent success rates. Discectomy and laminectomy procedures achieve 90% success rates with 75% patient satisfaction. Spinal fusion demonstrates 70 to 90% success rates for pain relief in properly selected patients, with fusion success rates exceeding 95% using modern techniques. Even for chronic back pain, there's substantial reason for hope. Research demonstrates that 35% of people with chronic lower back pain achieve complete recovery within 9 months, and 41% recover within 12 months. The key is finding the right combination of treatments and maintaining consistency with your treatment plan. Comprehensive treatment approaches. Modern back pain treatment follows a biopsychosocial model that addresses physical, psychological, and social factors contributing to your pain. This approach recognizes that chronic pain involves more than just physical damage and requires comprehensive treatment. First-line treatments include exercise therapy, which has the strongest evidence for effectiveness. Low-impact activities like walking, swimming, and cycling strengthen the muscles supporting your spine. Core strengthening exercises are particularly important, as strong abdominal and back muscles provide natural spinal support. Physical therapy typically shows benefits within 4 to 6 weeks, with treatment duration averaging 6 to 8 weeks. Psychological interventions play a crucial role in recovery. Cognitive behavioral therapy helps change pain-related thoughts and behaviors that may be perpetuating your suffering. Mindfulness-based stress reduction programs show significant evidence for chronic pain reduction. Acceptance and commitment therapy focuses on accepting pain while pursuing meaningful activities. Medical management includes both traditional and breakthrough options. NSAIDs like ibuprofen or naproxen provide moderate evidence of effectiveness for both acute and chronic back pain. The new medication suzetrigine offers hope for those who can't tolerate NSAIDs or opioids. Antidepressants like duloxetine are recommended as second-line therapy for chronic pain. Creating an effective support system. Family support significantly impacts recovery outcomes. If you're supporting someone with chronic back pain, remember that their pain is real and can be unpredictable, with good days and challenging days. Offer emotional support by listening without judgment and acknowledging the reality of their struggle. Encourage appropriate activity while helping with tasks that may aggravate pain. The goal is to support independence while providing assistance when needed. Maintain open communication about their needs and pain levels, asking specific questions like, "What helps you most?" and "What do you need today?" For those experiencing back pain, don't isolate yourself. Stay connected with family and friends, participate in activities when you feel able, and consider joining support groups. The American Chronic Pain Association offers education and support groups. Pain Connection provides virtual support groups that meet daily via video conference. These resources provide peer support and practical pain management advice. Advanced self-management strategies. Self-management is crucial for long-term success. Start with basic pain relief techniques like heat and cold therapy. Apply ice wrapped in towels for 15 to 20 minutes during the first 48 to 72 hours after injury onset. Switch to heat therapy using heating pads or warm baths after initial inflammation subsides to relax muscles and increase blood flow. Maintain proper positioning and posture. Use lumbar support when sitting and sleep on your side with a pillow between your knees or on your back with a pillow under your knees. Avoid prolonged bed rest, which can actually worsen outcomes. Continue daily activities as tolerated and take short walks regularly. Implement pacing strategies by balancing activity and rest. Break larger tasks into smaller, manageable segments. This prevents overexertion while maintaining function and independence. Stress management techniques significantly impact pain perception. Practice deep breathing exercises, progressive muscle relaxation, and guided imagery. These techniques activate your body's natural relaxation response and can substantially reduce pain levels. Nutrition and supplement strategies. Diet can influence inflammation and pain levels. Reduce processed foods, trans fats, and refined sugars while increasing anti-inflammatory foods like fatty fish, leafy greens, and berries. Maintain adequate calcium and vitamin D intake to support bone health and prevent osteoporosis-related back pain. Certain supplements may provide benefits. Magnesium, 100 to 500 milligrams daily, may help with muscle relaxation and pain reduction. Turmeric or curcumin offers anti-inflammatory properties. Devil's Claw, an herbal supplement, shows evidence for back pain relief when taken in minimum doses of 50 milligrams harpagoside daily. Omega-3 fatty acids provide anti-inflammatory effects that may support pain management. Always consult healthcare providers before starting supplements, especially if you're taking other medications, as interactions can occur. Workplace and environmental modifications, ergonomic improvements can significantly reduce pain and prevent recurrence. Set up your workstation with proper lumbar support, monitor at eye level, and ensure your arms remain at 90-degree angles when typing. Alternate between sitting and standing throughout the day, taking breaks to move for 5 to 10 minutes every hour. At home, ensure your mattress provides adequate support for spine alignment. Use supportive seating with cushions or lumbar rolls in cars and chairs. Consider long-handled tools to reduce bending and modify tasks to break heavy work into smaller segments. Preventing recurrence prevention is crucial because 69% of people experience back pain recurrence within 12 months after recovery. Regular exercise is the most effective prevention strategy. Maintain strength and flexibility through consistent low-impact activities. Focus on core strengthening exercises and maintain proper posture during daily activities. Learn proper lifting techniques. Lift with your legs, not your back. Keep objects close to your body and avoid twisting while lifting. Maintain a healthy weight to reduce pressure on your spine and quit smoking, as it impairs healing and reduces blood flow to spinal structures. Managing setbacks and maintaining hope recovery from chronic back pain is rarely linear. You'll experience good days and challenging days, but this doesn't mean you're not healing. Setbacks are normal and don't indicate treatment failure. The key is consistency with your treatment plan and patience with the process. When setbacks occur, return to your basic pain management strategies. Apply heat or cold therapy, practice relaxation techniques, and maintain gentle movement. Avoid catastrophic thinking and remember that flare-ups are temporary. Maintain realistic expectations and celebrate small victories. Recovery is measured not just in pain reduction, but in improved function, better sleep, increased activity levels, and enhanced quality of life. Focus on what you can do rather than what you can't. The role of professional healthcare teams, successful back pain management, often requires a multidisciplinary approach. Your primary care physician coordinates overall care and provides initial treatment. Physical therapists prescribe exercise programs and teach movement techniques. Pain management specialists offer advanced interventions for chronic pain. Psychologists provide cognitive and behavioral pain management strategies. Orthopedic or spine specialists address structural problems requiring specialized treatment. Each professional brings unique expertise to your recovery journey. Cutting-edge research and future directions research continues advancing our understanding of back pain. The Backpack Research Program is developing precision medicine approaches using biomarkers to match patients with optimal treatments. Artificial intelligence is being integrated into physical therapy to provide personalized treatment algorithms. Virtual reality therapy such as RelievRx has received FDA approval for chronic pain management. Focused ultrasound offers possibilities for non-invasive ablation procedures. These innovations provide hope for even more effective treatments in the future. Your personalized recovery plan. Creating your personalized recovery plan starts with accurate diagnosis and risk stratification. Work with your healthcare team to identify your specific type of back pain and contributing factors. Address modifiable risk factors like poor posture, weak core muscles, stress, and fear avoidance behaviors. Develop a treatment plan that combines appropriate medical interventions with self-management strategies. Include regular exercise, stress management techniques, ergonomic improvements, and family support. Set realistic goals and track your progress over time. Remember that recovery is a process, not a destination. Focus on improving function and quality of life rather than complete elimination of pain. Many people learn to manage their pain effectively and live full, meaningful lives. Conclusion. Your journey to recovery lower back pain is one of the most common and challenging conditions affecting millions of people worldwide. However, the evidence clearly shows that recovery is not only possible, but probable with the right approach. The breakthrough treatments available in 2025, combined with evidence-based conservative care and strong self-management strategies, offer unprecedented hope for those suffering from chronic back pain. Your pain is real, your struggle is valid, and your desire for recovery is achievable. Whether you're dealing with acute pain that you want to prevent from becoming chronic, or you've been suffering for months or years, effective treatments are available. The key is finding the right combination of medical care, self-management techniques, family support, and professional guidance. Remember that you have more control over your pain than you might think. Small daily actions, when consistently applied, can lead to significant improvements over time. Recovery requires patience, persistence, and hope, but the evidence shows that better days are ahead. Take the first step today. Reach out to healthcare professionals. Implement the self-management strategies that resonate with you and build your support network. Your journey to recovery starts now, and with the remarkable advances in treatment available today, you have every reason to be optimistic about your future. You don't have to suffer in silence. Help is available, recovery is possible, and your best days are still ahead of you.